My name is Mira Trevetti. I'm a Pediatric Cardiology Fellow. I am a PGY6 and I'm in my third year of Pediatric Cardiology Fellowship.
We've been training fellows now for almost 60 years, and for me, I think the most fun part about my job is watching, fresh fellows come in with kind of that deer in the headlights look, and then after 3 years, just becoming amazing pediatric cardiologists.
I can see the evolution for the first years to the third years and how well trained in all areas of cardiology they are.
The first year is really meant to be that immersive experience into every major subdiscipline within pediatric cardiology. Our fellows will have multiple exposures to inpatient cardiology, ambulatory cardiology, the echo lab, cardiac cath lab, electrophysiology, and cardiac intensive care unit. As the fellow transitions into their second year, what we really hope is that they've put a lot of thought into where they want their career to go and what they want to focus on for their next 2 years of training. And that way we can tailor their clinical and research experience so that it ultimately furthers their careers. What I encourage my third year fellows to do in that last year of training is to try to get more experience into their discipline of choice so that if they're going off to an advanced fellowship program, they can hit the ground running. Or if you're going to join faculty right away, you're going to be ready to go.
I look at myself from when I started, when I was a nervous little fellow, to now as a third year that I feel ready to do the next step. There isn't one time that I have felt intimidated to ask an attending for clarification or a question about a patient management, and they literally just drop what they're doing and will explain and spend the time with me to make sure that I fully understand. That commitment that I see from our staff really just goes to show how they really truly value the training and wanting our fellows to excel as a pediatric cardiologist.
We really thrive together to provide the best care for the most kids, and we do teach our fellows how to provide that best care.
You are one-on-one with the attending. When you're in the cath lab, you are next to the attending, you are getting access, you are pushing wires.
The outcomes are really based on a very strong team effort. So all the components of the Heart Institute work together to achieve that goal. And this involves CT surgery, cardiology, critical care, and cardiac anesthesia. So the 4 teams really unite to work in a very collaborative fashion to achieve that goal.
For me, as a physician that works hand in hand with surgeons and anesthesiologists, I think that atmosphere in the operating room is incredible. And then, when a patient leaves the operating room and transitions into that cardiac intensive care unit, now you have a completely different team. That transition from initial diagnosis to OR, cardiac intensive care unit to step-down unit really seems seamless, but it takes the work of so many individuals working well together to pull off.
The training that you receive here at UPMC Children's is second to none.
You will see here from the bread and butter pediatric cardiology to the most complex. So if you walk through our cardiac ICU, you are going to see patients with the most complex congenital heart defect, heterotaxy, hypoplastic left heart, whatever you want to see in terms of complexity. You may also see somebody with an artificial heart, a patient on ECMO, but you could also see the simple ASD. You're going to have that wide variety of lesions that you know very well how to take care of.
So being a referral center, not only do we see patients from Western Pennsylvania, we also see patients from West Virginia, Ohio, and New York, as well as multiple countries around the world.
I think as a parent, anytime your child is sick, this is a huge deal. I tell people it's a big deal when your child has a diaper rash or a hangnail or they're uncomfortable. What we see on a daily basis within cardiology is we will see the sickest of the sick children.
Our echo lab, we have about 20,000 echoes annually, which is a significant volume, and that has consistently grown over the last 10 years.
We do an immense amount of cardiac cath cases, upwards of 800 cases per year. Our surgical volume is anywhere from 500 to 600 cases a year.
Roughly 10 to 15 heart transplants a year, and somewhere between 13,000 to 14,000 outpatient clinical visits.
In our program, there are plenty of opportunities for research. And this includes clinical research in areas like cardiac catheterization, electrophysiology, critical care, imaging, all the areas of cardiology. We have experts that are very much willing to provide mentorship to our fellows for clinical research.
We also collaborate with many different divisions within the hospital, such as radiology and the neonatal intensive care unit. I think that we have enough opportunities available that we can really tailor a meaningful research experience to every fellow's background and interests.
Our fellows are very much ready to take that next step. Whether that next step happens within our institution or whether it happens elsewhere, we really provide all the components it takes to make that step successfully.
If you are someone who is eager to learn, ready to hit the ground running, and looking for that one-on-one mentorship, UPMC Children's Pediatric Cardiology program is right for you.